Welcome to Chair Chats, the podcast from Emory's Department of Medicine with DOM Chair Carlos Del Rio. During this edition of Chair Chats, join us as the Department of Medicine Chair, Dr. Carlos Del Rio, chats with Dr. Kimberly Manning, the Vice Chair of RISE, Represent, You, Support, and Elevate. Today, we're talking about the upcoming 5th Annual Health Equity Day happening on Tuesday, May 20th. Stay tuned for their conversation on this edition of Chair Chats.
Welcome to the Emory Department of Medicine Chair Chat podcast with me, your chair, Carlos Del Rio. This week, we have with us Dr. Kimberly Manning, the Department of Medicine Vice Chair of RISE Initiatives. Welcome to Chair Chat, Dr. Manning.
Hi, Dr. Del Rio. Good to see you.
It's always fun to see you. You've been doing a lot of stuff, but today I want to focus on Health Equity Day, and I want to start by asking, tell me what's going on and what's the activity this year?
Yeah, we're super excited. This is our 5th annual Health Equity Day. Hard to believe we've been doing this for 5 years, and this was really the baby of Dr. Jada Bussey Jones, our inaugural vice chair for RISE. And Health Equity Day this year will be May 20th. It will start with some exciting presentations and highlighted featured presentations, and then involve both virtual posters. And this time, for the first time ever, we're having a hybridized version of Health Equity Day, where we will have live posters at Grady Hospital. Yeah, it's going to be at Grady Hospital. And all of it will kind of culminate with grand rounds, which will, for the first time, be held in the Trauma Auditorium at Grady. And our featured speaker this year for the grand rounds lectureship will be Dr. Yolanda Wimberly. She's the Senior Vice President for Health Equity at Grady Memorial Hospital. It's going to be a really exciting day.
That's amazing and just such an important work. And you have, also a pretty impressive person as your keynote speaker and a lot of good stuff happening. But tell me, why do we need to focus on health equity? Why are we doing Health Equity Day?
Whenever we think about our mission at Emory, and we think about the fact that we are really trying to deliver exceptional care and to be outstanding investigators and teachers that ultimately will benefit the population that we serve. And the population that we serve is not a homogeneous population. There are lots of different things that people need. And unfortunately, the ability to achieve excellent health care and excellent health outcomes is about more than just, writing prescriptions and making appointments. So we like to think about all of the factors that can stand in the way of individuals achieving their very best health. Health Equity Day is an opportunity for all of us to think about some of those factors. Sometimes there's social determinants of health. Sometimes it's just how we're thinking about a systems issue, right? Sometimes it is through a question that has yet to be asked, or highlighting a question that has been asked that others haven't really learned about yet because they haven't had access to it. So the exciting thing I think about Health Equity Day is that it's something for everybody. I know that we're in a time right now where, sometimes it feels complicated for us to focus on this kind of work. But it's really not complicated at all. Our true north is that we want to see our population achieve optimal health. We want to be leaders in that space by allowing people to ask the right questions, teach the right things, and grow a workforce that allows us to best care for the population that we serve. And Health Equity Day is just one component of that, along with all of the other parts of our mission at Emory that we're so dedicated to.
Absolutely. I couldn't agree more. At the end of the day, you can call it health equity, you can call it whatever you want. I sometimes tend to say, let's provide health access to all, equal health access to all, because regardless, I don't care if you are the person that financed the bridge, the person that built the bridge, the person that lives under the bridge, everybody should receive the same care. Everybody should have the same access to care. And we're very fortunate here at Emory that we have, among our health partners, we have all the way from Emory University Hospital, a ordinary referral hospital, to Emory Midtown, to the VA, and Grady, of course. And Grady is critically important to our mission, and that's why it's particularly important that we are partnering with them on Health Equity Day. I noticed that this year the theme is community partnerships. How did you come up with that theme, and why community?
Yeah, I think, many of us who spend time down at Grady, and even the individuals who are at our other sponsoring sites and participating clinical sites, we recognize that, again, the community surrounding the hospitals and the individuals who are our stakeholders, they're really important partners in us getting work done. Whether it's something like access to care, whether it is even mapping out future locations for other outpatient facilities, we really need our community partners to kind of get the word out. I think a time that became very apparent, and I know you know this, Dr. Del Rio, is during the time of the pandemic, when we were trying to get patients in, we were trying to help do preventative measures, we were trying to expand access to vaccinations. That really required our community partners to engage. Patient education is also a space where we really want to tap into our community partners as well. And we just recognize that, a big component of health equity goes beyond the doctors, the nurses, and those who are working in healthcare. We have to be able to meet our patients where they are. And there's just so much exciting stuff happening around our community partners that people just don't know about. I'm excited that Dr. Wimberly will be able to share with us some of the really, really robust things that the Grady Health Equity team is doing. For example, many people don't know that every single week at Grady, there is a mobile shower that comes to Grady Hospital, and they allow our patients who are unstably housed to come and take showers, but they also launder their clothes while they're there and offer some support and offer some resources to them. This is something that's happening multiple times a month at Grady. And this is just one sliver of an example of ways that we can reach our patients. And someone might say, what does that have to do with health equity? Well, but the thing is, if you can't do something as simple as a basic need, how are you going to keep a doctor's appointment? How are you going to be able to go to that rehab appointment or that physical therapy appointment or pick up those prescriptions that you need when your basic needs aren't being met? And our community partners really help with that and also provide a resource that sometimes we aren't even tapping into.
Absolutely. As you know, my work is in HIV, and in HIV, community has been critically important in everything we do, from research to delivery of services to policy to advocacy. And a phrase that is used by community is nothing about us without us. And this really emphasizes that, people living with HIV or risk of HIV should be at the center of decision-making regarding policy, programs, an affected community, and ensuring their voices are heard and their experience is valued. And this is, I think one of the magic sauces of HIV has been the partnership with community. From the very beginning, community members have been at the forefront, sometimes not agreeing with us, sometimes pushing, sometimes disagreeing, but at the end of the day, thinking what is best to advance what we're doing. And if it hadn't been for the partnership with community, I could guarantee you we would not be where we are today in HIV. So to me, partnering with community is something that has to be done. This is a critical component in doing service delivery, in doing research, in doing anything we do that relates to health and healthcare.
Yeah, and the community is also a big part of us building trust with our patients. And, if you are not talking to your community stakeholders and you are not talking about the individuals who are directly impacted by the work that you do, it's going to fall flat. The Ponce Clinic is an extraordinary example of thoughtful community partnership. I spend a lot of time working on the inpatient service at Grady, and I can't say how many times I've been caring for a patient living with HIV. We get through managing the problem, and then it's time to help the patient stick the landing and get out of the hospital. and make sure they can thrive. And we know that there are a lot of factors sometimes that can stand in the way of that. But wow, I can't even count how many times I've called over and spoken to a colleague over at the Ponce Clinic who shared with me an initiative of some sort that I had never even heard of, or some resource that I didn't even know about, and what a difference it makes for our patients. I think our liver clinic at Grady is also another really great example of community partnerships where, again, we have a model for healthcare delivery, but we can't get that model out there if we aren't in the community making sure that our patients know about it. And our patients, again, are not homogenous. Some of our patients are folks that can come right in, get their blood drawn, and find out they're living with hepatitis C on a screening blood draw. But some of the other individuals might be individuals who inject drugs and who may be through some outreach program who discover that they're living also with hepatitis C. And we figure out through our community partners how to get those individuals access there. And there's just so many examples of things like that that allow us, again, to get to that true north, which is to help our patient population thrive and have optimal health.
Yeah, I mean, you spoke about the bandwidth showers, but it's partnered with Project Open Hand or the Food Bank, because food is medicine. It's partnering with Gateway and other organizations that provide housing, because housing is healthcare. And you could go on and talk about those different partners that we need in order to really get our patients optimal health. And we're far from providing optimal health to everybody, but I think, as you say, it's our true north, is where we want to be. Tell me what else is happening with RISE and what other initiatives are you working on right now?
Oh man, that's so exciting. We like to think about this as a longitudinal approach to, again, getting toward our goal of helping our patients achieve optimal health. And that starts with who the doctors are, and when the doctors and the staff members and members of our community get here, how included they feel in their ability to do their best work. And so I'll point out a few of our initiatives that I'm really excited and proud of. One is a program that is called the RISE Virtual Visiting Mini Clerkship. And it was born actually out of the pandemic. We had a visiting clerkship for students from different backgrounds to come here and do rotations. Of course, the pandemic halted all of our visiting students from outside facilities. And as it turns out, we decided to do the thing that everybody says they pivoted. We pivoted and decided to do a virtual program. So we moved to a 2-week mini clerkship all over Zoom, where students joined us Monday through Friday for a few hours a day. And instead of being at one site rotating with one team, they met people from all over the department, all different hospitals, all different levels. And it has proven to be one of the most exciting recruitment programs that we've had. So that's for M4 students. So we will be doing that again this next year. That started in 2020, and we intend to continue going forward with that. And we have another program that started 2 years ago. It's called Rise to Medicine. This is a longitudinal partnership starting at the undergraduate level. And this is in partnership with Tuskegee University in Alabama. And we learned through the RISE mini clerkship the power of virtual connections and how impactful mentorship can be, even over virtual platforms. And so we enrolled freshman and sophomore students at Tuskegee University, which is a historically Black institution in Tuskegee, Alabama, my alma mater. And we're already really excited to see the direction this is going. And why did we choose this particular institution and program? Because we know that as we're trying to build our workforce, not everyone has the same social capital. Not everyone has a person that they can call to help them get a summer program or a letter. And we've actually found that more than 90% of the students who have been accepted to Rise to Medicine are individuals who don't have a doctor in the family. So we're really excited at that initiative and hope to someday see some of those students in the internal medicine residency. So, and then I have to highlight our residents. Our residents, the Churchwell Diversity and Inclusion Collective, we support them, which is named for Andre Churchwell, our first Black chief resident at Grady Hospital. The Churchwell Diversity and Inclusion Collective, they do advocacy work, They do outreach, community-facing work, but also work to have a supportive and inclusive environment that allows all residents in our program to thrive. And I could not be prouder of the work that the CDIC, or Church World Diversity and Inclusion, have done so far. They've been really remarkable.
It's about role modeling, it's about mentoring, it's about sponsoring. It's really about doing all those things that has really benefit all of us throughout our career. So you really want to play it forward, and this is an amazing way to do that. Well, thank you so much for your time. Thank you so much for everything you do, and I really look forward to Health Equity Day. Again, reminding everybody, can you remind us of the date and where we need to be?
Absolutely. So save the date for May 20th, 2025. That is a Tuesday. This year will be our first hybrid Health Equity Day, meaning you have a component where you can log in and look at it over Zoom, but we strongly encourage you to come join us in person by 11 a.m. to see our live poster sessions, and also to hear our keynote, which will be at the time of grand rounds, and it will be still streamed, but we welcome you to come in and see us in person at Grady Hospital. This will be in the trauma auditorium at Grady, and our live posters will be in the hallway leading down to the trauma center. So lots of exciting things. And I'm sure you're going to learn about some things happening in your very institution and in your very department that you didn't even know about. So come and join us. We can't wait to see you.
I'm looking forward to seeing you there. Thank you so much.
Thank you.
Thank you so much for tuning in to this edition of Chair Chat, the podcast from Emory's Department of Medicine. For more information, visit medicine.emory.edu. Thank you so much. We hope you'll join us next time for Chair Chat.